Hello, everybody. We're just getting started. Please say hello in the chat. And if you want to say where you're from, that would be great too. We are going to get started in just a second. We're going to introduce ourselves and tell our personal story. And then we are going to talk about some of the things we've learned that may be applicable to the work that you're doing or the storytelling that you're interested in doing. And then we will take questions. So we aren't going to be taking questions from the audience until towards the end. But if you put your question in chat, we will try to get to it later in the session. Hello, Hadzun from Sacramento. So just wanted to give a little bit of time for people to assign into this session. As I mentioned before, we all have healthcare stories, but what we're going to be talking about today will be applicable to whatever issue you're interested in whatever issue your story is about, whatever you care about. Research shows that making meaning out of trauma can be helpful in healing. So sharing your story not only can help the world, but maybe will be helpful for you personally. I will get started by introducing myself and my story. 4 years ago, I was diagnosed with stage 4 cancer. And while I was going through treatment, that happened simultaneously with attacks on our healthcare because the day after my first chemotherapy appointment, Republicans in the US House voted to dismantle the Affordable Care Act. So while I was fighting cancer, I was also fighting to retain my health insurance that was keeping me alive, and so many other people. So that kickstarted me into being a healthcare activist and all of the work that I have done since 2017, since we successfully stopped the attempts to repeal the ACA. And let me turn it over to Anastasia.
Sounds good. So my name is Anastasia, and I've worked in progressive politics my entire life, in consulting, in nonprofits, in government, on campaigns. But my story for this case, and that's really applicable here, is that it started on a Monday in June 2019. I dropped ice cream on my kitchen floor, and I really struggled for a very long time to clean it up. And I just thought I was tired, but my symptoms escalated so quickly. By that Thursday, I was en route to urgent care to figure out what was wrong. Had a headache that felt like glass exploding in my head, and I just decided I can't live like this. So it took the doctor one look at my crooked smile and klutzy coordination to suspect I was having a stroke and to go urgently to the ER. And the good news is I wasn't having a stroke. The bad news is I had about a billiard ball sized tumor in my brain, a tumor that biopsy would soon reveal to be glioblastoma, what you may have heard of as killing Ted Kennedy, John McCain, and so many others. And thinking about it right now brings me right back to that moment of shock and disbelief and just horror. And to one of the first things the doctor said after he read me my scan, insurance is evil. And I've since been reminded every single day that he wasn't kidding. Treating cancer has become like a second full-time job for me, with paying for it often feeling like a third, both on top of the real job I must maintain to have health insurance and afford all the copays, co-insurance, deductibles, premiums, and of course, prescription costs that it won't cover. And the reason I share this is that I originally sought to keep the focus of just sharing my cancer story on the personal lessons I've learned through this experience, and I can speak about that too. But the honest truth is that I can't separate my cancer story from my paying to treat my cancer story. It's all one story. And sure, renewed perspective on what really matters in life may make me calmer as I make those calls to insurance and hang out on hold with billing departments, or as I cross-examine every single bill that I get for mistakes that will cost me, because of course, they only make mistakes in their favor. And being calm is great, and renewed perspective is great. It will matter so much less if I'm broke and dead. And so I'm passionate about sharing my story as yet another piece of proof that this needs to change and the system needs to change immediately.
Elena.
Perfect. Hi, everybody. I'm so excited to be here. I am Elena Hung, and I am also a mom. My healthcare advocacy story began in 2017, like Horace, after the new administration office talking about repealing the ACA. So I was really scared and worried and angry. And I decided one day to really just show up on Capitol Hill. I live in Maryland. I'm a 30-minute train ride from the Capitol. And so I brought my daughter, who was born with a number of medical needs and disabilities. And I wanted to tell her story. It was really that simple. And I called some friends, and day became 2 days, became 3 days, weeks into months, into now years. And like Laura was saying, I found power in making meaning out of my trauma with healthcare. So that, in a nutshell, is my story.
Ola.
Hi, everyone. I'm happy to be here at Netroots Nation for a second time. And a little bit about my healthcare story. I grew up a normal, average kid up until I was 9 years old, and I was diagnosed with a rare heart condition called cardiomyopathy. So my life kind of spiraled out of control in 2 years. By the time I was 11, I became the recipient of a life-saving heart and kidney transplant. This meant that I would be on medication for the rest of my life, and I would have mountains of bills to pay to sustain myself and to stay alive. And the ACA, the Affordable Care Act, changed my life because of two reasons. It allowed me to stay on my parents' health insurance until I was 26, and it allowed me, 25, I should say, and it allowed me to receive health care even though I have a pre-existing condition. And so I began advocating on Capitol Hill with different nonprofits, Planned Parenthood being one of the nonprofits, and lobbying Congress to keep the Affordable Care Act alive and keep it from being repealed. And my story doesn't just end at having a heart and kidney transplant at 11. At 19, I was diagnosed with a rare form of cancer, a post-transplant cancer caused by my transplants. And 4 to 5 years later, I was treated at Johns Hopkins Kimmel Cancer Center for my cancer. And I was able to stay on my parents' insurance and receive life-saving treatment because of the Affordable Care Act. So my advocacy story centers on this one vital piece of legislation that changed my life for the better. It's enabled me to live my dreams, and it's enabled me to start a small nonprofit that provides college scholarships to disabled youth. We also provide grants to youth service programs and youth service projects. And so I'm happy to be here today, and it's all because of healthcare policy that focused on protecting the rights of disabled people like me.
Thanks. And Raf.
Hi, I am Raf Naboa E. Rivera. I live in New York City. I am a longtime political activist, having worked on 5 presidential campaigns. I'm also a combat veteran. I work for a healthcare startup, and I am a cancer survivor. And how I got into telling my story was a combination of making it back from the Iraq War and then getting cancer, and sort of figuring out how to tell my story, how to go ahead and talk with audiences, and how to share my experiences so that we could make change on both the local and the national level. So I'm just really happy to be here at Netroots, and I'm happy to talk and learn from my fellow panelists and also from you.
Great. And the first thing we're going to talk about is, how public are you about your healthcare story, and how did you decide to be public or not? And for me, it was a pretty easy decision because the stakes were so high. This thing was happening to me, but at the same time, I had the ability to share my story and make change that affected many more people. So if I had been diagnosed in a different time, I don't know that I would have been so public. I don't know that I would have needed to be so public, but the timing of it wasn't really a choice for me. I was diagnosed at the beginning of April, and then I spent a few weeks going through doctors, figuring out exactly what was going on with me. And then I started going public to my friends and family towards the end of April. But again, the day after my first chemotherapy, my insurance was under attack. So it was never really an option for me not to speak up, but it's always your choice whether you tell your story or not. And Ola, how about you?
Well, as you can see by my name, I am American, but I'm Nigerian American. And I come from a culture where disability is not talked about, health problems aren't talked about. That stuff is kept within the family. So I went several years thinking that my condition was shameful and that it shouldn't be shared. When I was 11, 12, I was in middle school. And I came back to school after a transplant and told no one. I didn't tell my friends that I had 2 transplants. I kept it secret for years because I was so ashamed. So coming forward and being public with my health conditions, it was very hard for me just because of my cultural background. But one day I got an email from Planned Parenthood that they were seeking speakers to speak out in favor of the Affordable Care Act alongside several senators and members of Congress. And so I said, hey, I have an ACA story. I'll be able to share it. And hopefully it's compelling enough to inspire others to advocate for further protections for people with disabilities when it comes to affordable health care. So it really was the whole 180 of being ashamed to now having pride and disability pride in who I am. I also should mention I am a wheelchair user, so my disability became visible when I was in my 20s. I used to not use a wheelchair. I didn't have any visible disabilities. I can still walk and appear normal. I'm a part-time wheelchair user. So having to have a physical disability that people could now see really pushed me to being more open and becoming a storyteller.
And Anastasia.
I was diagnosed in June 2019, as I mentioned in the intro, but I didn't share my story publicly until February 2021, which is this year. So waited more than a year to share that. And the reason the impetus for me sharing it finally with publicly, because I did off the record conversations and events to share it, but ultimately I realized I have grade 4 brain cancer, not stage 4, and there is no known cure, and there are only 5 medications that are approved to treat it, in addition to 1 device. And what that means is that if the FDA has to approve something, insurance will not cover it. And ultimately, there are very few treatments available, and ultimately, GBM, the prognosis isn't great, and the statistics for outcomes are not encouraging. And so I published my story in Elle. I was very grateful for Be a Hero for their support in broadcasting and sharing that story and writing that up and sharing it in Elle magazine. And ultimately, I've just decided to be public about it because the treatment options are so limited, and I'm not just advocating for myself, I'm advocating for everybody who has this condition, and the numbers are growing and in a worrying rate.
Thanks. And next we're going to talk about the benefits and drawbacks of being public about your story. And Ola, what do you have to say?
Well, I will say this, that being public about your disability can have several drawbacks, which includes employment discrimination, because you can Google me and see that I've had major organ transplants, I've had cancer. That way, people have a reason not to hire me. And in order for me to have health insurance, good health insurance, I have to work. So that, for me, it opens the doorway for employment discrimination, and it also opens the doorway for public criticism. I've given various speeches, and one of my speeches went viral and has 3.7 million views on Facebook. And if you read the comment section, you see how divided our nation is and how little society cares about people with disabilities. The comments are horrible. You open yourself up to bullying. You open yourself up to public criticism and shaming. And it's very painful to know that one of the comments was I was a paid actress and that this never happened to me just because I look a certain way. I look too healthy to be sick because I'm a young person with multiple health conditions, and even though my disability is visible, I still look quote unquote normal. So having people believe that you're lying or that you're an operative for the Democratic Party or you're an operative for the liberal agenda is very hurtful. I'm for healthcare equity. Regardless. No shade, no disrespect to the Democratic Party for all the great things that they've done, but it doesn't have to be a partisan issue. Healthcare equity should be, bipartisan. So yeah.
Mm-hmm. And Elena.
Yeah, there are so many benefits and so many drawbacks that I have experienced in the last 4 years. Starting with the benefits, I would say that, I really wish I had a greater perspective when my daughter was a baby in the NICU. At that time, I was really terrified and couldn't really imagine a life beyond her medical needs. And I wish I had seen more examples of that. And one day I saw a photo of a child on a ventilator, which my daughter was also on a ventilator. She was at the kid was at the playground, just playing, and in my aha moment that my kid could have a life beyond, the hospital, the four walls of a hospital. And so I would like to think that in sharing my story, aside from the piece and going to Capitol Hill, that I'm helping normalize disability for other families, that I'm helping remove the stigma and shame of having a disability, remove the stigma and shame of having a chronic medical condition. A lot of what Ola was talking about before, I don't want kids to grow up with this shame. I want to change the narrative that disabled kids can and do experience joy and laughter, and they can have fun and have a great quality of life. And so part of doing this advocacy side by side by my daughter is to show that disabled kids are kids. They are fun and happy and naughty and do all the things that their peers do. And so that's been a big part of it. And I hear from other families of how meaningful that is for them, because like me at one time, they are so overwhelmed with the medical piece of their experience and can't really see a life beyond that. And so that has been really rewarding, and I would like to think that's been all really healing for my own personal trauma to see that other families don't have to go through that. Some of the drawbacks, it's a big part of it for me is privacy, and I am in a unique position here, the only one here who is, I'm sharing somebody else's story. I'm sharing my daughter's story. She is a minor. She's 7 years old. She can't really fully give her informed consent to having her story shared. And so it's something that I wrestle with every single day. I balance her privacy with what I hope is this greater goal of, again, normalizing disability and helping others. With that, I'm very, I do share. I'm mindful of how to protect her in the public eye. A lot of what Ola said about nasty comments and criticism, make sure that I protect her from that. I make sure that I protect, the parts of her story that I do share, that it is part of a larger family story and not just hers. So that when, she Googles herself in a few years, that she is proud of the work that we've done and not ashamed or feeling the stigma.
Anastasia.
I'll start with the drawbacks to end on a positive note with the benefits. Completely agree with what the previous speakers have said about both sides of the equation. Employment discrimination is very real, and I've encountered those negative comments. I've also even encountered folks pushing specific treatments that are disproven, and that they can just use my commentary on the healthcare system as an ad for that. Just go look at my tweets. And the other drawback is that once you do share your story, you can't put that cat back in the bag. Everyone knows that is a part of you, but also it's going to be a part of me anyway, and it's going to be a part of the rest of my life. And so the benefits ultimately for me really outweigh the drawbacks. The benefits are meeting others with this condition, discovering people who have outlived the statistics for this by quite a bit, and that inspire me. Discovering other experimental treatments or supplements that can discourage cancer growth. And ultimately, I think the biggest benefit is that I have a cancer that currently has no known cure. There are all those limited treatments, but there's no known cure. And so even if I can't change my circumstances in that sense, I can make a positive impact on others, and I can make a difference in the world by sharing my story.
Thanks. And next, we're going to talk about how do you make space for your feelings when working with your personal story, and what are your boundaries and how do you protect your mental health? Raf.
So I think it's really important to be, when it comes to boundaries and when it comes to like your mental health, I think it's really important to be honest with yourself about how you're feeling, both in the moment and, you know, medium and long term, and to just really acknowledge and lean into whatever it is that you're feeling, and to be honest with yourself and to be honest with others. I think it really helps to be firm and aggressive with your boundaries. Figure out what those are, and they're going to be different for everyone else, right? And then you just stick to them. Figure out what it is that you're comfortable sharing, that you're comfortable talking about, and disclosing, and then go from there. For me personally, it was really helpful to engage in therapy. So the cancer that I was diagnosed with in 2007 was testicular cancer, right? And so there's, you know, first of all, the thing that comes up with testicular cancer when you bring it up is Lance Armstrong. And, you know, it's sort of like, hey, you got testicular cancer, let's get you Lance Armstrong's book. Not so much now that he's like disgraced, but still, back then that was sort of like the thing. But really, like among guys, it's sort of a sensitive topic to talk about. And so like, how do you broach it? How do you talk with like fellow guys about that? Because if you don't treat it, it can get very aggressive. And, you know, that sort of like conversation is really important for young men to have. It's one of the leading cancers for young men, right? So for me, it was really important to be able to say like, hey, I had this, I was able to get treated, you know, I had an orchiectomy, the whole 9 yards. You can still do whatever it is that you want to do with your life beyond that. But it's really important to get checked and do those things. And so I make a habit, you know, whenever like November comes around, you know, we have like the whole Movember thing, you know, help save, you know, grow a mustache, save a bro. And so, you know, that's the sort of thing that I do. But that combination of things and being able to talk about it with my therapist and being able to sort of process whatever it is that I'm feeling, and being able to share that in the spaces that I choose to share it with is really helpful. And I find that being able to share my story helps other guys open themselves up, make themselves vulnerable, and share their stories as well.
And Elena.
Yeah, well, it's still a learning process for me. I'm still learning how to make space for those feelings. I also, like Raf, have started therapy in part because of this process, in part to have an outlet where I can feel, where I can process it. So I would say in terms of boundaries, again, you know, the really important part of my story is that it's my daughter's story. So the boundary constantly about what she would be okay with me sharing. I try to do this with her at my side. I'm careful to talk about it as a family experience, and rather than, let's say, her diagnosis and medical history and details of that sort, but really how we are affected as a family. In terms of the privacy piece, that's where a lot of my boundaries lie. I have decided that just because I have chosen to be public about my story, it doesn't mean that I have to share everything. It doesn't. I get to choose what I share on any given day. I do a lot of interviews with the media, and journalists have asked really intrusive and personal questions at times. And make no mistake, healthcare is very personal, but they've asked what I have, you know, at times felt were very personal questions. And I've learned to be comfortable to say, you know what, I don't want to, I'm not going to answer that. I don't feel comfortable answering that question or sharing that information. That's a boundary that I have learned to enforce, and most importantly, not feel guilty about, not feel like it lessens my advocacy in any way. also, in the beginning, I felt like I had to keep coming up with new ways of sharing my story. I wasn't used to telling it over and over and over again. So I felt like I had to rewrite the story or come up with new angles to tell it and make it exciting and fresh. And that was really silly in retrospect. But now I pretty much tell it in the same way. I don't feel like it is less authentic or less meaningful. But knowing that I'm speaking to a new audience, that's the point, right? Is to have a greater reach each time I speak. I'm not speaking to the same people over and over again, but that I'm speaking to a new audience and hoping to find a new reach helps me, it helps take away the stress of having to reinvent my story. And it really helps me get comfortable in telling it in a way that works for me and helps me own my own story. So I would say that's been the biggest takeaway for me in making this for it and enforcing my own boundaries. My mental health in the process.
And next, we're going to talk about how can people as individuals tell their story effectively? What have you learned? And how do you balance your own experiences with the needs of groups that may ask you to share your story? Ola.
I feel like the written word is very powerful, and you can share your story by simply writing it and sending it to your congressman, and that can change everything. I mean, I spoke with my congressman, and he ended up inviting me to President Trump's first State of the Union, and I'm not sure what to call it. I was invited because of my story, and I was invited to represent what the Affordable Care Act meant to the disabled community and why it should be saved and not scrapped. And I feel like using language and if you're not able to get in front of a camera, or if you're not able to, get with an organization and have them kind of push your story out, that you can do it on your own. You can write an article and pitch it to a magazine, or you can write your story and pitch it to whomever, to TV stations, whomever. I feel like it's hard for me to get in front of a camera and tell my story, and a lot of people have the same issues. So use the written word.
And for me, I come from a communications world. So the AFL-CIO sent me to Arkansas a decade or so ago, and I was on the ground helping get the Affordable Care Act passed in the first place. So I was working with storytellers, but it wasn't my story. So I wasn't coming at this from zero with no communications training. So I think that was helpful for me, but I had never been the primary speaker before. I had been the person helping the person tell their story. One thing as a medical frequent flyer is that my story has a lot of aspects. I can talk about insurance and surprise medical bills and the high cost of pharmaceutical drugs. And there are many pieces, because if you incur serious illnesses in this country, you will have serious horror stories. So what I focus on sort of depends on the context, what we're trying to achieve. If I'm speaking at an event, what is the group's mission? What is the mission of this event I'm speaking at? So I will take pieces of my story that are most relevant to the issue at hand. And I also I started a nonprofit, Healthcare Voices, to provide the kind of training that I would have wished that I had and continue to do. And at healthcarevoices.org/learn, you can see the archive trainings that we've already done on how to write a letter to the editor or how to do public speaking. So it's really important to me to make sure that other people have the support that maybe I didn't have at the time. And I was really winging it. So I'm glad that there is so much more out there for storytellers on whatever issue you're working on, because as we've talked before, there are real drawbacks to becoming a semi-public figure, and you should be prepared for that and to never read the comment section ever again. So next, that segues into where has telling your story taken you that you couldn't imagine before, and what outcomes has your story led to? Ola. Ola, you're muted.
Sorry about that. I would say the proudest moment that I've had, and somewhere I never thought I'd be, that my advocacy would take me to, would be testifying before Congress about affordable prescription drugs. I mean, when I was in college, I was a government and politics major. I'd always seen people testifying and thought, wow, that is powerful. I would love to be just a fly on the wall. And then I got to be more than a fly on the wall. I got to be a speaker. I got to talk about my experience. I got to share my story with people who make decisions that affect my everyday life. It's also brought me to the White House, particularly the Obama White House. I was an intern in the Obama White House, and it was a hard internship to get. During the Obama years, the acceptance rate was that of Harvard Law School. So I got to go to the White House. I got to work in the White House, and I also got to advise the Obama administration on disability policy. And I got to meet the president and thank him in person, sitting at and when I met him, it was at the signing of his last bill, the Centuries Cure Act for cancer research. I got to shake his hand. I got to thank him and tell him, you know, I've had all these surgeries, I've had all this, and it's thanks to you and thanks to your work that I've been able to survive all that I've been through. Because without health insurance, without the Affordable Care Act, I wouldn't have survived. I don't think millions of us would have been able to survive as well. So it's taken me great places I thought I'd never be. I've become a political commentator on Democracy Now! And MSNBC's AM Joy. So it's been one hell of a ride, and I'm so grateful.
Elena.
Yes. I have also had one heck of a ride that I did not imagine when I first started. I started and I run my own organization, Little Lobbyists, a family-led national healthcare and disability rights group that members of Congress frequently call for input and collaboration. I am in a position where I'm helping inform policy, have a seat at the table, as they say, help make decisions that affect our lives. That's huge. It's huge. You know, and I have often said that there is not a single thing that I would change about there's nothing I would change about Xiomara, but there are a million things that I would change about this world so that it would be worthy of her. And I feel like this platform has given me a chance to do that, to make those changes so that disabled kids like Xiomara can have a better life. So that has been just enormous. And on a personal note, I would say that telling my story has helped build this community of families like mine, families with children with complex medical needs and disabilities, and also disabled adults, and specifically disabled adults who were had acquired their disabilities when they were children, and they can help inform families like mine. This has always been more about chosen family than nonprofit organization for me. And this is, you know, telling my story that first time has opened that door wide open. And it's been so meaningful. It can get pretty isolating and traumatizing. So it makes all the difference in the world to know that, you know, we're not alone.
And for me, well, I never would have expected a few years ago that Trump would be president. That was not even a possibility. And then I never would have expected to have cancer. So the past few years have been very surreal in that sense, in that sometimes none of it feels real because it's strange. But so some of the things that I have had the opportunity to do, like speaking with Joe Biden at the Democratic National Convention, is just more strangeness piled onto an already weird fever dream. So in that sense, sometimes, what is strange? Trump was president. Everything is normal now that we never would have ever thought happened. But I think that the fight to save the Affordable Care Act taught a lot of people that we can do big things, that we have more power than we think if we share our stories and use it. Anastasia.
Oh my goodness. Sharing my story, it's scary, of course. It's that vulnerability for sharing your story and coming out as I have this diagnosis. It's going to affect me for the rest of my life. It is definitely impactful, but it's also, and it's that vulnerability is also scary. But it's taken me to so many different places that I never would have imagined. The first I would say is publishing my story publicly in Elle. The next day, Joe Biden, which many folks have already referenced, he hosted a bipartisan meeting on finding a cure for cancer. And my piece was ultimately about channeling the effort for finding a cure for COVID or a vaccine for COVID into finding a cure for cancer as well as the next step. And I never would have imagined either of those things happening without this. I've also been grateful to be published in Brain and Life. I've been so grateful to meet people. Again, it's scary to put yourself out there. It's scary to share this part of my story and share this part of my life. But it's only through this that I've been able to meet folks at the National Brain Tumor Society, meet with my congresspeople and my senators and their teams, and be an advocate for this. I've also been so fortunate to partner with folks like Be a Hero, which Laura also works with, and to share my story specifically to advocate for universal medicine. Folks are absolutely right that the ACA, the Affordable Care Act, has made a tremendous impact on discrimination against folks with pre-existing conditions, which can range from cancer to everything like pregnancy and acne. And folks are definitely right that it's made things better, but we're far from universal medicine. And the thing about health insurance is that it's not designed to maximize length or quality of your life. It's designed to maximize their profits, specifically private insurance. And I am so grateful that I've been able to advance advocacy for that work and support that, and work with Be a Hero to advance that, meet folks in National Brain Tumor Society. And to wrap things up, I wouldn't have been able to speak at this panel. I'm deeply grateful for that, and I'm happy to be here.
So speaking of storytelling, how can nonprofits or causes find storytellers for their issues? How were you found by others or got involved in sharing your story? Raf.
So in my case, I've been sharing multiple stories about myself for a long time. I mean, I was found first as a combat veteran by Operation Truth, which then became Iraq and Afghanistan Veterans of America, back when the Iraq War was really happening. And I got used to sharing my story and doing that. But then when it came to healthcare, I really started getting comfortable about sharing not just my specific story, but also my mom's story. She has suffered from multiple sclerosis now for over 40 years. And she and our family both felt the spiky end of not being able to get insurance because of having a pre-existing healthcare condition, right? And so when we started fighting for the Affordable Care Act in 2009, it became really imperative, I felt, for me to not just share my story, but also my mom's story, and to lift up a ton of other stories that I was coming up against. And that brings me to my other point, which is that if you have a nonprofit and you're looking for stories, it's really important to look at your own people to see who's telling compelling stories about themselves, right? And to help them tell their stories, and to be able to figure out, how compelling those stories can be to getting your message across and to getting decision makers at every level, whether that's national, local, state, depending on the arena that you're fighting in, for change, to get those stories. And so that's whenever I am looking to share stories and that sort of thing. I'm always looking at the people that I work with, the volunteers that I work with, folks that I come across on the trail and that sort of thing.
And for me, with sharing my story, I come out of the progressive advocacy and campaign world. So I already had some connections. As a small business owner in Las Vegas, I already did an event or two about the Affordable Care Act way before I was sick, way before I was diagnosed. So I think it was helpful for me that I was already locally involved and knew some people. So then when this thing happened to me, I was able to then speak out and advocate locally. They already knew me, I already knew them. I would get invitations to speak at a lot of things. I think if you're looking for storytellers, like Raf said, start with your members and your supporters. But also, what Be a Hero in particular has had a lot of success with was just tweeting something out and calling for people with their stories. And if somebody sees it on Twitter or Facebook or a different social media platform and speaks out, they are willing to speak out to some extent. They've already gotten to the point where they are willing to be public about whatever it is they're sharing. And that's a part of it because it's a big step. That first step is a really big step. And some people never get there, and that's okay because there are real drawbacks to sharing your story publicly. Like we said before, it's never required. It is your choice to do that. But if you also local and national papers, you will see people with compelling stories that have gotten to the point where they're willing to share it. And often you can find the person that has advocated, like Anastasia, probably you get emails and so on from your LPs that people can find you because you're willing to be found because you've done that much. So that's another thing you can do. And just be sure to give people the training and the support to be able to share their story and then what happens after that, because don't leave them hanging out there alone. And next, what do you wish people would have told you before you started sharing? What kind of support or trainings would have been helpful? So to continue my answer, I had been through a media training in 2005. So over a decade ago, I'd actually been through a media training, which is probably something that most people have never done. So I had a certain base level of training, and I had talked to reporters in my day job doing digital advocacy and so on. So I would talk to tech reporters every so often and give them a quote about something. So I had that base level of familiarity. But if somebody is starting from scratch, then they need to know, how to talk to a reporter, what does on the record and what does off the record mean, and figure out what it is you want to say before you pick up the phone, so that you can be friends with a reporter. One of my good friends is an NPR reporter, but if you're having a conversation with a media person, they have an agenda and so should you. And not necessarily in a bad way, but just knowing what are the points you want to make and make sure you circle back to those points. Or if they don't ask those questions, they'll usually ask you something at the end. Do you have anything to add? And that's your chance to say the thing that you want to say. And people get in trouble with the media if they haven't thought through what it is they want to say, or if don't drink and talk to the media. Raf, what would you like to add?
I mean, so I come from a communications background, so that also helped me in telling my story. But what I would say is that I think if you get a chance, answer, and you're getting asked questions, answer the question that you want to answer. I think a lot of people that are new, particularly new to talking with reporters and the media and that sort of thing, you sort of like can get caught up in answering the question that you're being asked, and you should just really answer the question that you want to answer. So you want to share your stories and you want to give the answers that you want to add. that you want to give. So if a reporter is asking you a question, you shouldn't feel compelled to answer specifically that question, especially given limited time. Just, say what you want to say and just leave it at that.
Yes, bridge and pivot tactics, and good media training will cover that. Anastasia.
I think Laura and Ralph have already covered the vast majority of this, but what I would also add is there will be people who will discourage you from sharing your story if you try to run something by them. And if you are determined to share it, go for it. Don't let them discourage you. And remember, it's ultimately what matters to you, and especially for anything that might affect you for the rest of your life. If you want to share it, go for it. And we've already spoken to so many benefits. Vulnerability is scary, but it can be so impactful. So don't let folks discourage you.
Absolutely. But it's also a real thing. I know at least one person that her job situation did not allow her to advocate. So she changed jobs. But I mean, it is a real thing. Like, there are consequences to speaking publicly, and just be aware of what those consequences might be before you do it, so you don't get ahead of yourself and find you're not ready for those consequences.
It's a much better way to word it. Thank you.
And who are some other people who inspire you with how they've made an impact with their personal story? Raph.
So this is gonna sound a little bit hokey, but definitely Anastasia is one of those people that inspires me, just because, if you know anything about her diagnosis, it can be the sort of diagnosis that just kind of like knocks you for a loop. And it's just really remarkable, and just demonstrates a lot of courage, and just being able to grapple with that and be able to say, you know what, I'm just going to go ahead and pile on through, and I'm going to do what I can, because this is the only time that we have. And so it's important for me to go ahead and do that. Along those same lines, Adi Barkan, in terms of being able to share his story and be able to fight for the kind of changes that he wants to see with Be a Hero, and not letting ALS, deter him from doing that. And on a larger scheme, just because I'm a little bit of an ornery character sometimes, I just really dig Greta Thunberg, because Greta just always gets invited to like these big conclaves, whether it's like the United Nations General Assembly or whatever, and these people are looking at, one of my good friends really pointed it out in a way that I like, which is that when a lot of people invite Greta, they're looking for absolution from what they've done in terms of climate change, particularly a lot of these like national leaders and global leaders. And she's just not going to give it to them. She's going to say, like, you've screwed up. You've done these things that are really awful, and like you need to change. And I am not here to like, absolve you of what you've done. And I think sometimes I think that there's catharsis in anger, particularly when it comes to our healthcare system and how it's mistreated and misappropriated funds and treatment and that sort of thing. And like that helps. It helps to bring that sort of like cathartic anger to the fore. So I find folks like that inspiring as well.
And Ola.
I'll say Elena, because I love my mother, but I would love to have a mama like Elena. Everything she's done with Xiomara in terms of sharing her story and being an advocate for her and surrounding her by positive examples of people with disabilities, so her daughter doesn't feel like she's growing up isolated in only a community of me, or only a community of a community of we. And Haben Girma. Haben, she's a friend of mine, but if you guys don't know, she's the first blind and deaf woman to graduate from Harvard Law School. She may not be sharing a healthcare story, but she shares her story, and she does it in an inclusive manner in which she talks about the racism people with disabilities endure, that she's endured. It's such a unique experience being a person of color with a disability, but when someone speaks truth to power and talks about the added biases people of color with disabilities endure and suffer with, that just is so powerful to me, and it inspires me.
Anastasia.
So first of all, I'm deeply inspired by members of the disabled community and folks who have advocated for improvements to healthcare. Many of the folks on this panel advocated for the passage and the continuation of the ACA, and I'm deeply grateful for that and deeply inspired by folks exactly like Laura, but everyone on this panel has been such an advocate and so inspiring for me. And anyone who's advocated for universal medicine, like again, folks on this panel, I'm deeply inspired by that. And especially also Adi Barkan, who's also come up as well before. He just had a documentary come out about his work called Not Going Quietly, and I strongly encourage folks to watch it. And I think it's so important to raise our voices, and I'm inspired by that vulnerability for folks sharing their experiences and advocating for the progress we absolutely need to see.
And you all inspire me every day.
Mm-hmm.
So those were all of the questions that we plan to talk about. And now we will take your questions. So if you have any questions, put them in chat and we will do our best to answer them. Feel like we need the Jeopardy theme music or something. While we wait for questions, are there any panelists that have anything they want to add to what we've talked about so far?
I like the point that Erica made a bit ago about one of the things she likes about being Canadian is that there is, universal medicine and easier access to treatments and universal healthcare. Strongly agree. I hope that is the next step for the United States, even with the remarkable improvements that we've seen with the ACA that, again, so many folks on this panel have advocated for. It's still a nightmare. And I'm sure that everyone on this panel can also agree with that. So that is completely agree that Canada has it figured out, as does the rest of the developed world. And I hope that's next for the United States as well. And in the meantime, I'm sure everyone on this panel, including myself, will keep pushing for it.
And a question from our host about how being visibly disabled can make getting a job difficult. Is there a way to prep an employer for that? Or is there anything you can do on your end? Go ahead, Raf.
So one of the things, like I said, I work at a healthcare startup. My startup, Wealthy, works with companies, very briefly works with companies in terms of helping those companies, get caregiving services for their employees. It's a business to business sort of thing. It's not really something that like regular people sign up for, although I wish we could do that. But we're doing a ton of hiring, right? And
Raf, you are muted.
well, there we go. Is one of the things that I ask, because we're doing a ton of interviewing right now, is if there's any accommodations that we need to make for that person. We want to be like very conscious. We don't want to like breach confidentiality, break the law or anything like that. But we also want to be very conscious to making those accommodations, and we want to be really inclusive of folks, so we can get a diversity of experiences at our company.
Anastasia, you had something?
Yeah, I think especially in this era of folks working remotely is so common, especially in the kind of quasi aftermath of COVID-19. I would also say that if folks don't raise it, you don't necessarily have to bring it up, especially if you're interviewing remotely. You'd be surprised there's a lot of people that definitely know, and I'm very public about my experience. I mean, it's literally my pinned tweet. It's very publicly shared, and my Twitter is linked to my signature. It does not take Sherlock Holmes to figure out my story. But I'm still surprised by how many people don't know it. And if they don't mention it, I don't mention it. I just check to make sure that, for instance, with the jobs I'm interviewing for, that they have great health insurance. I'm looking for that platinum plan. If you don't have to mention it if you don't want to. And especially if you're interviewing remotely, if they don't bring it up, you don't have to bring it up.
And Ola.
I'll speak from my experience with employment. I am a part-time wheelchair user, so I can walk and I do look quote unquote normal when I walk. I used to literally hide my wheelchair in a stairwell or wherever I could before I went on an interview. And that, I'm not promoting hiding your disability at all. I don't think it's right what I did, but there's a level of shame associated with disability that a lot of us have to overcome in order to get employment. So my advice would be to seek employment with disability nonprofits and disability orgs, because we need more people working in those environments and towards disability advocacy, so we can be in the mainstream jobs that don't have to do with disability. So I say seek it out. And also there are affirmative action. Well, I know you're in Canada, but here in America, there are affirmative action programs specifically for disabilities. Like the federal government has this program called Schedule A, where if you get a letter stating that you have a disability, it doesn't have to show what kind of disability you have or say what kind of disability you have. But that's how I got my job with the federal government, was I was hired through a special hiring authority. So I would seek out employment with people, with organizations and places that appreciate disability, that understand disability, that are disabled led.
And next, we'll take a question from the audience. Hi, Erin. What are the biggest next steps in the expansion of the ACA we need to look out for? And one of the things Congress is working on right now, the Build Back Better bill, would fix the Medicaid gap. So low-income people in 12 states, including Florida, Georgia, Texas, North Carolina, and others, can't get health care right now because they make too little to be able to afford it, but they don't get subsidies on the ACA exchange because the ACA was designed for low-income people to have Medicaid. So these people are locked out of healthcare. It's over 2 million Americans, and they're working on a fix, but we'll see what Congress does with Build Back Better. Also, as a part of that bill, it would make the temporary credits that made the Affordable Care Act more affordable through the American Rescue Plan permanent, because that help this year expires at the end of next year. So then the prices would go back up. And also, they're looking at other healthcare pieces, including funding home and community-based services, including strengthening Medicare to include vision and dental and vision, dental, hearing coverage, and lowering the cost of prescription drugs. Those aren't specific to the ACA, but we're in a moment right now where a whole bunch of stuff is on the table, and we need to make sure that it winds up in the dinner, because they're making hard choices. And if anybody else wants to step in and add anything to that. And I think we're good. So we have just a couple minutes left. Thank you very much, everybody, for joining us today. If you have a personal story, whether it's about healthcare or not, you can go to healthcarevoices.org/learn, which has a whole bunch of archived trainings that should be helpful for you, regardless of your issue. Also, if you are a healthcare voter, you should join us at healthcarevoter.org. And next up is Elena. Are you there, Elena?
So sorry about that. Wow, this hour flew by. Thank you, everybody. Thank you for allowing me to share my thoughts with you this past hour. So I'm going to talk a little bit about Little Lobbyists, which is my family-led group advocating for kids with complex medical needs and disabilities. If you're a family member, please share your story with us at littlelobbyist.org. We also have a lot of resources on our website, specifically on home and community-based services that Laura just talked about. So org/care can't wait, and you can see examples of families telling their stories, as well as a call to action on there.
Thank you. And Ola.
Hi guys, so my nonprofit website is www.project-ascend.org. You can make a donation to our Disability Scholarship Fund at that website. You can also look for me on my personal website. I do public speaking. I do motivational speaking, www.olaojabumi.com. And thank you for having me. It's been a pleasure being here.
And Anastasia.
So before I was diagnosed with my condition 3 weeks into starting with Elizabeth Warren's presidential campaign, where we got the opportunity to actually share Audie Barkan's story and also Alana's story as part of that work. And right now, I'm back at Trilogy Interactive, being a senior director leading the social media work. And we work with all sorts of progressive organizations, for instance, Patients for Affordable Drugs, and other progressive organizations that are committed to making society work for everyone, not just the wealthy and well-connected, kind of like the Warren for President did. And reach out if you ever need help with social media or just any kind of digital work. And this is another way I make meaning of what I'm going through. It's that activism, it's making life better for others, because truly when we all do better, we all do better.
And thank you, everybody, for attending. Our Twitter handles, you can see, are displayed. You can find us on a whole bunch of different social media platforms. And stay in touch. Thank you.